We are here today at Health 2.0 with another extraordinary health transformer. Avinash Kodey, how are you, sir?
I'm doing great, and thank you for inviting me here for this.
So, co-founder and CEO of MDOps.
Yes.
What's your vision for MDOps?
The whole idea is help the physicians manage the patient care in the simplest and the most effective way so that they can actually prevent a patient from going to the hospital. That's simple as it. Right now, they are so bogged down with the EMRs. That's what it is. We're trying to simplify that.
So they're wasting time with the EMRs.
They're wasting time.
And you designed a virtual clinical assistant.
Correct.
That's called Millie?
Millie,
okay.
Yes.
And how is it different from, say, Siri or Alexa, some of these other tools that are out there?
So one of the main things that it does is it has the knowledge and the awareness of the clinical terms and the clinical understanding that is critical when it's interacting with the physician. That's number one. But more importantly, it has the ability not to connect with just the physician's EMR, but has the ability to connect with multiple EHRs, because the patient goes to multiple places. He goes to a hospital, he goes to a nursing home, he goes to an office visit, a practice, a specialist care. It has the ability to be set up by a health system to connect to multiple EHRs so that when a physician asks a question, it can analyze it across all the data and give them a 360-degree view.
Wow.
At the point of care.
And so who are you selling this into? Are you selling it straight to the providers and the health systems?
Yes, we started off selling small to individual physician groups, and now we are getting in, and now that the technology is mature and has been in the field for a couple of years now we are going after the larger health systems, because that's where the real value is. The ability for a large health system to connect all their provider organizations, whether it be a hospital or a physician office, together so that everyone at every point of care can make the best possible decision.
So take us into the future, just a year, 2, 3 years. What do you solve? Doctors are spending so much time just entering data.
Right, correct.
How is this going to change things?
So the idea is take the physician from entering the data to being told, this is the patient's condition. The clinical assistant is taking away the responsibility from the physician of analyzing the data. It does the analysis and it comes up with the suggestions and it points it. Instead of forcing him to record data or inundate him with alerts, it shows him, this is the situation, this is the recommended treatment plan, yes or no. And the physician essentially looks at it and says, yes. That's the idea. The idea being the physician can now treat more patients, make smarter decisions, because now the clinical assistant is taking over a lot of those manual grunt work, as well as the rapid analysis of data.
Right, and people have been familiar with scribes for so long, but this is one, it's virtual, and two, it's all voice activated.
Right. So that's the first part of the difference, right? One is virtual, he's typing in manually, as against this virtual assistant which will transcribe instantly. But that's just the tip of the iceberg, right? You go further beyond that, and this assistant is not a scribe. While he's not a physician and not trained or doesn't have the intelligence of a physician, this virtual assistant can be taught that level of intelligence, so it can actually analyze and show the physician the exact key points. Instead of giving him 10 pages of data, he's saying, don't worry about all that. These are the things that are relevant, and this is what you need to look at.
So technology is moving so quickly.
Absolutely.
I mean, a couple of years ago, Alexa wasn't even around, Siri wasn't around.
Correct.
Millie wasn't around. I like the name Millie, by the way.
Thank you.
So what happens over the next few years? What are you most excited about, the potential with what you can do here?
So right now, we are focusing on giving physicians the key data points at the point of care. And the whole purpose of that is to help the physician get ahead of the curve of anticipate when the patient is going to go into this exacerbated acute modes, because that's when typically the patient goes into the hospitals. The idea is get ahead of the curve. So by 2 years, we want to be able to accurately estimate or predict when this patient or which patient is going to get into this acute state down the road, so that the physician can get ahead of the curve and fix that and stop him instead of, trying to do the firefighting like he does today.
And as AI and analytics platforms improve, this only gets more.
This gets, as we deal with more and more data and have the ability to analyze it and understand the trends, it will become smarter and smarter. And I think in the coming 2 years, we should be there where the reliability of it to anticipate or predict the patient's the exacerbated modes, that's going to get more and more accurate, and that's going to significantly cut down the health system's biggest cost, the unnecessary readmissions into the hospital.
As an entrepreneur, what have some of your biggest lessons learned been over the last few years? Maybe wisdom you could pass on to other entrepreneurs just getting started.
I think especially in the healthcare industry, if it is a startup, purely talking from a startup perspective, I think what they need to do is they need to focus. They need to have a razor-sharp focus, and they need to actually get a customer and prove it. And I think that has to be the starting point. Instead of trying to focus on trying to build the awareness of the product and everything, get it working at one provider organization, and trust me, they will come to you instead of you running after them. I think that's the fundamental thing. It's very basic, it's very obvious, but most of the people don't realize it. They're more into marketing and all that. I think it's about getting the product to work in production, in a customer site, and then everyone else will come.
You've had to keep pace with the rapid change of technology innovation and innovation. Talk a little bit about that and how you do that.
We are one of the early movers in the space that we are, but yes, like you said, the technology is moving fast. And like I said, we have got Alexas and Siris coming along, and they are getting intelligent. Probably it will take them a while before they get that clinical intelligence. What we are trying to do is not compete against the Alexas and the Siris, but we are building that back-end intelligence of the virtual assistant, which takes literally a long time for somebody to develop. So 2 years down the road, I don't see us competing against Alexas and Siris. We actually will have the ability to take that intelligence and offer it to an Alexa, so that a hospital system says, I want to use an Alexa. That's fine. We can actually give that intelligence that we develop with Millie, we can plug it into their existing virtual assistant, and they can use it there. That's how, but the key thing is that intelligence that we built in, that is going to be there, and that can be used anywhere. That's how we can, sustain and make it more acceptable, I guess.
So where can people go to learn more about MDOps and Millie?
So we go to our website, MDOPS, MD as a physician, MD, OPS.com, and from there they can reach out to us, and we will be glad to respond back with all the relevant information, live demos, anything. We'd like to get them going. We can teach the system as per the health system's workflows and get that going in their sites.
Fantastic. And how did you come up with the name Millie, by the way? Just got to ask.
We wanted to keep it short, and we had 4 of them. We did a quick short survey of a handful of sample data, and this is what sounded unique, and it was easy for someone to remember, and so we went with that.
Excellent, excellent. Well, thank you for everything that you do.
Thank you.
Congratulations on all your
Thank you.
progress and success.